So as far as the COVID numbers go, we're going to bring up a little review of charts that if you've been here before, it will look familiar to you. But I want to say things are really going in a good direction. And I'm going to talk a little bit about why. 2 months ago, at the beginning of January, we were, as it turns out, very near the peak of the surge that came about following Thanksgiving, Christmas, and the whole holiday season. A month ago, we were in much better shape and headed in the right direction. And it's good news to report that that has continued at a very steady and, in fact, a rapid pace up to now. I do want to say to you, just as a general comment on the state of COVID and the reporting on COVID, and the reason that I feel like it's important to do this kind of an update, there is all kinds of information out there, a lot of it bad, a lot of it untrustworthy. Sad to say, there are people and organizations who benefit from keeping you scared, from keeping you afraid of what's happening in the pandemic. And it's not my intention to say you shouldn't be cautious, you shouldn't be diligent and vigilant, but you need to be taking responsibility really for understanding your own risks, the risks related to people that you live with and work with and care about. We've all experienced loss throughout this thing. We had the first reported case of COVID in Georgia was a year ago last week, and later this week we'll mark the 1-year anniversary of when things really began to shut down, a full year. Happily, we're in a much better place now than I would say a year ago, and I'll show you some of why that is, but it's really important to get good information. So what the sources for this information basically are the State Department of Health, CDC, Atlanta Journal-Constitution is doing a pretty good job with a COVID-19 update page where they take some of that data and present it in a way that's easily accessible. And so that's where this comes from, but I just want to share with you that we each need to be cautious, following our own protocols, doing the things to protect ourselves and the people that we live and work with, and be careful about headlines that are meant to scare you and internet pop-ups that are meant to get you to click on them and keep clicking on them. So with that, let me just dive into what we have presented, the same charts that we've been presenting the last 5 or 6 months now. I guess I'm supposed to do that, right? There we go. So the chart on the left is basically cases reported by day since that's March the 3rd all the way over on the left side. So that's from the first case reported in the state of Georgia. You can actually make out, if you're looking closely, there's kind of a gray column there, not far from the left margin. That's the period of time which we had shelter in place in the state of Georgia. So it began roughly around the 1st of April and ended around the end of April. And so you can see the course of the disease through that time and after that time and what's happened since. So we had what seemed like a big surge last spring in March and April. It leveled off and stayed that way, and we had what seemed like a really big surge last summer. That sort of middle hump there is through July of last year. Came down again, felt like things were getting pretty good, and then the holidays led to an uptick twice the degree of what had gone before. But you can see it took a sudden sharp turn around the second week of January, and it has been declining rapidly since then. I want to point out one thing to you. I was talking about the way this is reported, and I wish I had a pointer that I could show you exactly, but that blue line, if you look all the way to the right, down at the bottom, that's updated through today's numbers. There's been talk in the last few days, we had this very sharp decline, you can see, from January the 13th or so until about 2 weeks ago. And then it seemed to be leveling off, and you heard a lot of talk about, well, we may be plateauing, we may be running into the variants, and we're not sure that it's going to continue. That little bitty difference between where it looks like it starts to flatten off there a couple of weeks ago to today, that's about a 30% decline in the 7-day moving average. 30%. So when 30% looks like a flattening or a plateauing, you know we've been on a good course. And the horizontal line that runs from that little circle all the way back to the left is just to give you a reference point of where we are right now versus where we've been over the course of things. And you can see we're right at as low as we were during the late summer, early fall, and we're just about down to where we were a year ago. The good news is that a year ago, we were on the increase, and we knew very little about why. We knew very little about how to stop it. We knew very little about how to treat it or cure it. We were washing our groceries when we brought them home because we didn't know if we might pick it up from the fruit that we bought at the grocery store. We were fumigating rooms and scrubbing seats and all of those things that we now know are good hygiene, but because we know much more about how the disease is transmitted, we have learned are not quite so necessary as we might have thought back then. So while we're at a similar level, we were heading up without a lot of information. Now we're heading down pretty sharply with much more information at our disposal. So the two charts on the right are another view of the same thing. The middle one there is Georgia confirmed cases on a 7-day average, and the far right is the same data for DeKalb County, and you can see they look pretty similar, which is not surprising relative to the statewide numbers. This chart down the bottom left is hospitalizations by day since they started reporting, and I think that's April, I forget the date, they didn't report that from earliest on. This is a really important part of the battle because you remember the first most important goal was to be sure that we had enough hospital capacity in the state and by region so that anyone who needed to be treated for COVID or anything else that people continue to need to be treated for were able to access hospital space. And so that line shows you on each day throughout almost a year's worth of data, how many people were in the hospital on a given day and how much hospital space there was. And so you can see where we are again relative to history. And in the right hand where there's that map with a green outline around Atlanta, that's our region D. And it says in that text there, we're just under 80% occupancy of general inpatient beds. That's a really, really good sign. That's what we want. It means we have room. If you need to go to the hospital for an emergency, for a treatment, whatever it might be, you're not going to get there and find that there's not space and you need to go somewhere else. The temporary facilities that have been set up a couple of different times and put in place because we were at a point where we thought they could be needed are down, and we're on a much more secure course as far as hospital space. This is the transmission rate. It's a calculation, a scientific calculation, estimating is the disease spreading more or contracting more. So if this number is 1, it essentially means that for every person who has the disease, one person is being infected with the disease. And so if it's more than 1, it means the number of people being infected is growing. If it's less than 1, it means that the number of people being infected is shrinking. And you can see it doesn't get a long way from 1. Early on, you're dealing with small numbers, and so the variation was great. But if you look back across all this time, only a couple of times have we gotten up to something like 1.2. Even fewer times have we gotten as low as 0.8. So today I think the number is 0.86. That's a really, really low number, and it's been there for a while. And that's cause and measurement of the fact that the spread of the disease has been greatly reduced in recent months, recent weeks especially. And this is about vaccination status. Just it says through 5 o'clock today. I think it must have been 5 o'clock yesterday because I got this before 5. So unless they were forecasting the future. But these are great numbers, and you can see that in that little table in the middle of the green map, 22.5 doses given per 100 people. That's 22.5% of the population has received a dose. 13.5, I think, is low. I'm feeling like that's maybe not the right number. Altogether, we've administered 2.3 million vaccines in Georgia. That's in the range of 20% of everybody. Some have had 2, some have had only 1, and part of the good news is we're learning that even if you've only had 1, it's even more effective than they initially thought. So here's what, I'm not sure we have one more. Go back. Here's part of the reason why things are going so well in this regard right now. And these numbers are not all in the report, but if you take the nearly 9 million people who've tested positive in Georgia over time, and you take the fact that we're testing over nearly 16.5% of everyone who's tested for antibodies has antibodies, and you add in the number of people here who've been vaccinated once or twice, we know that some people have some sort of natural immunity that we don't know how widespread that is or even how it works, but we know that there are people who appear to, despite being exposed repeatedly, haven't contracted the disease. The point is, if you add all those up, we're getting pretty close to 50% of everybody who, for some reason or another, we can be pretty sure is not going to get this disease, and they're probably not spreading the disease. And so every day, as we vaccinate more people, I think statewide teachers were eligible today. There's some big programs in place to get a lot of them vaccinated in a hurry, and we'll expand to the next categories of eligible people. Things are moving in a very positive direction. That's good news. It doesn't mean, of course, that you can go out and do whatever you want to do, or pretend like the disease doesn't exist, or that you might not get it, or that if you do, it won't be severe. All that can happen. It can happen today at the same likelihood that it was happening a year ago when we were much more frightened about it. But we do have information at our disposal now. We do have techniques and things that we can do personally and as a community to help hold the spread down and push ahead to the day when we're able to resume a much more normal kind of activity. So it's a good report. It calls for continued vigilance and diligence in following the protocols. It's enabling us to do things like go back to a hybrid meeting, open our doors. As the city, we want to serve, we want to provide services at the very highest level that safety will allow us to provide. And we're confident right now that that can be done in a much closer to normal way. We're going to hear some things tonight that we're doing in our facilities to assist with that. And we're going to keep pressing in that direction as long as the numbers and the state of things allow us to. And we'll keep hoping for more good news as we go along. So